Good evening, good evening, good evening. Can you hear me tonight? I hope you can. We have got a little squat tutorial tonight. I'm just going to check that you can hear me. Everything all right? Are we good? Are we turned on? Yeah, all good. All good. How are we all tonight? Hopefully we get a few people on the live. As promised, I'm going to do a tutorial once a week on a different exercise. Okay, so just give me a little hello, give me a little thumbs up if you're there. It would be nice to have a few people on tonight. If you've got any questions, of course, fire them away and I will do my best to answer them. Oh, I've got comments here. Hey Nina, you're right. Hello, Michelle. Lovely, jubbly. Okay, so a little bit of a different face for you tonight. I hope you don't mind me and not Kelly. Let me just sort myself out. There we go. There we go. Right, cool. So let's get started. For anyone that's on the live, fantastic. You are seeing it as it is now. For anybody that's going to watch it on catch up, that's great. You just missed the opportunity to ask questions and potentially get them answered now. But of course, you can ask them afterwards in the video. So we're going to talk about the squat. It's pretty fitting, actually, because I have just done my weekly depth check on my box splits that I'm attempting to learn at 35 years of age. Yes, I could have set myself an easier challenge. I embarked on the challenge of doing the box splits, thinking it would take me 30 days. I'm now 6 weeks in, although I am getting deeper. Okay, I'm going to post a little picture afterwards of my start and where I am now. And it is actually quite remarkable how much lower I've got, but also how much further I have to go. All right, so that's enough of that. We're going to talk about the squat. Okay, so I'm sure all of you teach this or do this in your classes, and it's really important that we understand the basics around the squat and also how we can adapt this for other people who may be in your class, and also just a few little points. You may learn some little pointers and tips of how you can improve your own squat and just some understanding of your biomechanics when you are actually squatting. Okay, so the squat is a multi-jointed movement. It's a compound lift, primarily articulation of the ankle, the knee, and the hip. Decreasing of angles, okay, with all three of those joints, with as neutral spine as possible, keeping our weight over the center of our foot, and the bar travels vertical, okay? So whenever we perform a squat and we're having a barbell on our back, just ensure that the barbell travels vertical. We don't want to see this irregular S. We want to see a nice straight vertical bar path with the bar, okay? Whenever you're doing any squats, ladies, you want to make sure that you're, you want to make sure, you want to make sure when you're squatting that your center of weight is over the center of your feet, okay? So that's going to be where optimal force production in a squat is in the center of the foot, okay? So if you was to look at yourself sideways and actually look at the travel of the bar, if you was to put a sensor on the end of a bar and be able to visually see it, you would see that the bar travels lovely and vertical, okay? This helps us in a number of ways. This helps us from stopping driving our glutes too far back or leaning too far forward, okay? We may be doing this. We may see people in our classes that are actually squatting like this. Now, everyone's mechanics and how they move is different. I understand people have different femur lengths, people have different torso lengths, but understanding the anatomy and how the hip actually articulates is crucial. Okay, so as we move up the leg to the femoral head, okay, closest to the hip, we have the actual femoral head, and then we have the socket, which is the acetabulum. Okay, this groove that the actual femoral head sits into plays a huge role in the amount of articulation we get with our femoral head. Okay. Oh, yeah. Sorry about that. Yeah. I don't know. Okay. Yeah. Right. So sorry about that, guys. So yeah, the femoral head comes up, obviously meets the hip. There is obviously, you do have synovial fluid and you do have capsules there that help this lubrication process. And then it sits in this pocket. And just progressing on from what we said before, this articulation of the femoral head is often limited by the shape of the pelvis. Okay. So it may be that you may have a particular shape femoral head and also the socket itself that might be hindering you achieving squat depth. I'm going to give you some tips on how you can actually get past this, okay, just with foot stance and maybe activating certain muscles that you might not have thought that you actually needed to isolate in order to achieve full depth. Okay, so I'm going to stand up. This is going to make this a little bit easier, and I'm just going to run you through. So if we can just, there we go. That's perfect. Oh, so much better. So we're standing here with a nice neutral spine. Okay, we'd all agree that this is the sort of like optimal squat position, would we? Okay, we need to first and foremost look at our foot position, ladies. All right. So if it is that you're standing with a very narrow gait, okay, in this sagittal plane, what's going to happen is when you initially break at the hips first, you're going to find that you soon run out of room. Side on so you can see. Does anybody, by a show of hands at home, have this problem when they squat? They struggle to achieve depth. They may maintain a neutral spine, but they go too far forward. Now, imagine if I had a barbell on my back, what would be happening now? I've come down. In order to try and achieve optimal depth, because we're always taught to drop below parallel, what's going to happen? I'm going to have to hinge forward to allow this to happen. So I'm going to show you a couple of things now that might just revolutionize the way you squat, okay? I'm going to do a couple of little pointers with just my body weight, and then I'm going to show you a few things you can use as cues that you can use in your class, or you can actually do yourself to improve your squat depth. So going back to the feet, when we spoke about the feet, okay, remembering the articulation of the hip, which I've just very briefly broke down to you. We understand that this femoral head moves in this ball and socket, okay? Circumduction, exactly the same. All right. Yes, different mechanics, but the principle is the same. They're both ball and socket joints. Okay. We're going to look down at our feet, ladies, initially. Okay. Hopefully you have done some sort of like release work for your fascia with a spiky ball. If you've got tight feet, if you've got restrictions in the fascia, and also, you know, coming down into the shins to the bridge of the feet, this is going to play a huge like sort of problem in terms of your reduction of angle between this fib tib and the top of your foot, okay? So if it is that you're limited in terms of your actual decreasing of angle here, you may want to start your squat regime with actually doing some release work for your feet, and also just doing things like foot to wall release, okay? That's really going to help decrease in that angle, and it's going to actually take a lot of stress off the knees and the hip trying to compensate. This kinetic chain, as we work up from the ground upwards, passes up the ankles to the knees to the hips and so on, okay? We call this the kinetic chain. This is where the sort of like energy is transferred, all right, going up. So that's the easiest sort of way to sort of imagine this. So we're going to go back down to our feet. What we're going to do is, we know now through the anatomy of our hip that we hit this pocket, okay? This capsule has its limitations in terms of allowing this range of movement from the femoral head. Something quite clever happens when we externally rotate the feet and activate the piriformis. What actually happens is it allows this femoral head to actually articulate in this socket much more, okay? So front on, what I'm going to show you is the difference between going from narrow, even myself, who I consider myself to have pretty good mobility in a squat, I still find it difficult. Now, with a barbell on my back or holding a kettlebell, that's going to start causing a lot of lower back pain, okay? Because it's going to be a lot of stress and it's going to be compensating. When we stand, slightly externally rotate the feet, maintain a neutral spine, okay? By neutral, what I mean is you're neutral. You're as most upright as possible, okay? Spine lovely and long. If we start flexing or hyperextending, this is going to put extreme stress through the lower back. We want to transfer as much of that force through the glutes, through the quads, through the hamstrings, okay? So we're going to externally rotate those feet. We're going to face forward exactly the same. This time we're going to break at the hips, and we're going to allow this articulation as the knees track wider, okay, to match where my feet are on the floor. You'll notice that if you stand there, ladies, and turn your feet out, you instantly feel the glutes activate, This is fantastic because these are going to be your power horses when you drive back upwards. We want to take the stress off the lower back and keep it through the glutes and the quads, and this is a fantastic way to do it. So we're going to slightly externally rotate straight away. We're allowing more movement here at the hip. We're going to keep ourselves facing forward, nice neutral spine, and we're going to drop down. Look at the difference, okay? So I'm going to come in. All I'm going to do is I'm going to turn my feet inwards. So now I'm not externally rotating. I've just gone back on train tracks. Look what happens. Straight away, that restriction. We talk about optimal positions when we're doing movements, compound movements. And optimal means is your best optimal, your most optimal position to move in. Okay. Squat very nice. If you do this with me, you know, you can thinking about these cues and these things that I'm talking about. Narrow stance. Oh, that's my limit. Just externally rotating the feet. Look at the difference. The depth, neutral spine, actually activating the glutes and giving my quads optimal position to actually fire. Okay, so if it is that you've done that and you still feel like you're not able to hit depth, or you get to sort of this position and you sort of get stuck, that's cool. I'm going to give you a few little tips now. You may know them, you may not, but I think these will help you. Okay, the first one is I just want you to hold on to the door handle, okay? So what I want you to do is hold on to the door handle. I'm going to kick this away so you can see me side on now. Keep your arms lovely and straight, ladies, all right? This may seem very basic, but I promise you, when you can unpick the biomechanics of a squat, all of your other movements will go through the roof, because what you've got to remember is it's learning that contact point of the floor that's going to give you maximum articulation through the hip and incorporate as many muscle groups as you can. It's going to keep your spine safe. Okay. And it's also going to get you into good habits when you're teaching your kettlebells, you're teaching your lift leans, you're teaching your circuit training classes. You're going to be able to demonstrate and give the correct cues to your class to make them move more efficiently and correct as well. So you're going to hold on to the door. Okay. Let me just get rid of this mat. And the name of the game is, I just want you to achieve the most depth you can whilst holding onto the door with straight arms, okay? So you're going to have straight arms. You're going to externally rotate the feet. So remember, ground up. Weight is over the center of the foot. Remember, optimal force production. Externally rotate the feet. Arms lovely and straight. And you're going to sink down, keeping a nice neutral spine. The idea is I want you to perform this a couple of times. And what you're going to notice is if it is that you are struggling to get below parallel, it could be that you're actually going to go below parallel for the first time. What this is doing is it's training your body to actually achieve depth. And it's actually articulating your hips to probably a range of movement that they haven't worked within, which is great because it's causing a bigger stretch, it's recruiting more muscles, and it's actually training those, you know, those skills, those motor skills to actually get you into that position. Because what I see a lot is people squatting, it's more a mind over matter thing. They defeat yourself because they don't think they can go any lower. So hands on the door, and you're going to squat. And then the idea is that when you let go, you should technically be able to mirror that movement pattern. Your arms aren't helping you. They are simply just stabilizing you and allowing you to have the confidence to drop into the squat. I've used this technique with quite a lot of people, and it's huge for their confidence to drop below parallel. Once you achieve it once, it's like, wow, I've unlocked it. I can get below parallel. And for anyone on here that already is going below parallel, that's fantastic. Challenge yourself to achieve as much optimal depth as you can. It may be that you want to push yourself to the point where you see, can I maintain a neutral spine? And how close can I get my hamstrings to my calves? How deep can I sit into this squat here? Now, the reason why the squat is so important, If you imagine that you're teaching or you're doing a Pilates class, any kind of movement class, and your depth is suboptimal, how is it that you're going to be able to teach a broader repertoire of exercises? Now, what do I mean by that? If you can't achieve optimal squat depth, your limitations here are off the cards. Your ability to move here, okay, is non-existent. However, if you can achieve full squat depth, look at the different variety of movements that you can perform in your own regime and teach. This has a huge crossover into kettlebells, allowing you to perform more depth in your goblet squats, allowing you to perform more depth in your sort of like deadlifts, all of these sort of things, okay? Now, remember, with the squat, it's very similar to the deadlift. It is a squat motion initially to get yourself into the position with a bar. So if any of you are deadlifting, okay, and you're struggling to achieve optimal depth and maintain a neutral spine here or sumo here, it probably is that you need to work on getting your depth, okay? I've got another tip for you. If the door doesn't work, this will absolutely work for you. So you've got two options. Now, this kind of comes down to you having confidence in yourself, okay? So I've put a foam roller behind me. It may be that that is a bit below your depth at the moment. Now, going back to what I said beginning, if you're struggling to hit optimal depth, it just simply is a case of you may potentially just need to externally rotate your feet, allow that femoral head to articulate a little bit more efficiently and activate the glutes. So what I've got behind me is a prop, all right? And what I'm going to use is a very light kettlebell. I'd like you to use a little bit heavier because it's a little bit more challenging. Now, what this kettlebell is going to do is it's just going to give me a little bit more weight to effectively help me down, okay? So I'm standing on the mat. My chest is upright. Arms are tucked in this front position, okay? Behind me, I have the foam roller, all right? That's just a little cue to help me. So I'm here and I'm gonna sit back here. I can still see it. I'm gonna sit back and I'm gonna sit on this, all right? So I'm gonna sit here. So I'm already below parallel. Now, stands a chance, I know for a fact, most of you will be able to sit down onto a foam roller. However, something quite strange happens. When you get rid of the foam roller, you go back to being stuck here, okay? So what you need to do is place something behind you that ensures you drop below parallel, okay? And what this is going to do is it's going to train you to drop below parallel. And you may need to do it a number of times. So we're going to externally rotate the feet, activate the glutes, and we're going to break at the hips, nice neutral spine, and we're going to sit down. Okay, and we're going to drill this. We're going to drill this 10, 12 repetitions, maybe 3 or 4. You're going to feel your quads activate. Then get rid of the foam roller and attempt to drop to the same position. And I promise you, you will be sitting below parallel. Now, in terms of the weight you're holding when you're squatting, it's really crucial, ladies, that you keep the weight to the center line of the body as much as possible, whether that be a barbell on the back of the neck, whether that be in the front rack position, or whether it be holding the kettlebell or even cleaning the kettlebell and squatting with it. Keeping that bell closer to the center of mass is going to make you more effective at hitting that optimal depth without putting stress through the posterior. Because what happens is if your form is slightly off and you're dive bombing forward or hinging back, you're going to get a lot of compensation. So if you're going backwards, not only are you decreasing that angle in your lumbar, you're going to stress your abdominals. If you're leaning too far forward, you're pushing your glutes back, you're severely at risk of stressing your lower back. I truly believe, regardless of body shape, femur length, there is an optimal squat position for everybody. You may need to squat slightly wider and almost go into sort of like a frog squat or a horse stance. That's absolutely fine. Knees can track with toes. That myth has long since been busted. If they couldn't, everybody would have to physically squat square on in the full train track position. Our feet externally rotate, our hips externally rotate for a reason, because you're meant to go there, okay? So don't worry about allowing your knees to track with your toes. We don't want excessive knee drop to the point where you're starting to get heel elevation. Okay, so if it is that you're squatting and you're starting to get heel elevation, that is absolutely a direct consequence of not having the efficient, optimal ankle mobility to be able to perform the squat. Okay, so you can use the spiky ball. I did a full tutorial and breakdown on a video of my full squat sort of mobility before I do any squats. So you've obviously can release the fascia in the base of your foot. It's going to make it a little bit more elastic, heat things up a little bit, make it a little bit more pliable. You could also start with, I have a couple of my clients who have quite tight calves and they struggle with hitting squat depth. Just stretch them out. So you're getting a decrease in angle here, okay? So fib tib to the bridge of the foot. But you're also getting lengthening through the hamstring and also the calf. You're going to find with a combination of releasing that fascia in the base of the foot, also stretching out the hamstring, stretching out the calf, as well as articulation through the femoral head, activating the glutes, and using a couple of these little tips, you're going to be able to achieve a far more optimal squat depth. You shouldn't feel discomfort. It is a sign that something's not quite right, so back it off. It should be a nice, freely, smooth movement when you squat. You shouldn't feel any discomfort. If you activate the key major muscles, you will absolutely feel great for hitting full depth through your squat. Now, just to finish, is below parallel really necessary? Now, I kind of throw that back to you, and I want you to sort of answer that question for yourself. Squatting below parallel or leg pressing below parallel effectively, even if you're at a 45-degree angle, may not really contribute hugely to any more muscular gains. However, the ability to work and have a body that works through full range of movement is key. So just to reiterate, will it build you more muscle? Okay, there's arguments, probably not. Not to the point where you would really notice whether you were going below parallel or parallel. Consequently, however, the key takeaway here is you should be able to squat below parallel. This shows that you have healthy, optimal articulation of the hip. If I was to say to you, does taking your arm above horizontal really contribute hugely to any more muscle mass? Arguably, probably not. But does being able to perform full circumduction of the arm have more practicality and mean that your joint is moving in a more optimal position? Absolutely. So the takeaway from this is keep practicing hitting optimal depth. I promise you, once you unpick it and you're able to sit in this deep squat position, the movements and the progress that you can make is unbelievable. The repertoire of exercises you're going to be able to do is going to improve. You're also going to be able to push your own performance through the roof because you're going to have a wider range of movements available to you. Okay. I don't expect anybody to be able to squat to full depth overnight. That just realistically may not happen, especially as we get a little bit older and especially how we've sort of moved into this position where we've sort of trained ourselves to move in a certain way. But just stick with it, use the cues, holding onto the door, dropping back onto, a foam roller or something just below parallel and train the body to trust going into that depth. And I absolutely believe that you can achieve it. So I hope that's enough of a deep dive on the squat. I could go deeper, but I just feel that that's enough when it comes to talking about getting into the squat position. If you have any questions or you're still unsure as to, how you can achieve a better squat, then just fire me over a message, but just take your time. Remember that whenever you perform, 99.9% of movements, unless you're from a chin-up bar, are going to pretty much start with your feet grounded on the floor. This is going to be where the force production is, okay? So making sure that your feet are in optimal position, whether that be for a squat, whether that be for a jump, whether that be for a pivot, is absolutely crucial, okay? So start with the feet. That is going to be your first point of contact. Stands a chance that that could be the difference between you progressing or you staying at the same point you're at. Work on that ankle mobility, work on releasing that fascia, stretching the calves, releasing the hamstrings, firing up the quads, and activating those glutes before you squat, maintaining a neutral spine, bracing the core, and trying to pick a focal point that you want to hold when you squat is really good. Especially try and pick a focal point that is in eye level, preferably not down or too far up. Okay, these are all little cues that are going to help you. I've got a client that I visit on a Wednesday, and she's a lovely lady. You know, she's an older lady. She's really nice. I've been seeing her now for, you know, best part of 4 or 5 months, and her squat mobility isn't fantastic. You know, she's got a couple of conditions, bless her, and you know, it struggles with vertigo. Now, this real challenge to get someone to perform a squat or, you know, do sort of like any sort of prone work that has vertigo. So just remember, reinforcing the cues, keeping that eye line is going to really help you. If you suffer with any of these things that I've just talked about, just take your time. You don't go any or any cacking, work in your own range of movement and stay in your own lane. Don't try and keep up with the person next to you. As you know, I've explained that there's different leg lengths, different torso lengths. If I'm squatting next to Kelly, she's going to do 3 squats to my 1 because she's so short. If I'm next to a basketball player, I'm going to do 3 squats to his 1. So very much stick in your own lane with it, perfect your form, and hopefully your performance can go through the roof. I hope that helps. I got a bit carried away then. I got quite excited about that. I love my squats. And thank you. I'm going to try this. Thank you. Perfect, Nicola. Yeah, absolutely. Give it a go. And, you know, the thing is, it's all about sometimes going back to basics. I'm currently trying to learn how to do the box splits. There's loads of people out there that can do the box splits. And when I saw my squat mobility and my mobility in my lunges, I thought, nah, this is going to be a piece of cake. And, you know, that's even me saying, coming from all my years of experience in movement and one thing or another, and even I found it difficult. I suddenly realized, Jesus, I actually can't get that deep, but yet I can perform a full squat. So I went back to in stages, working it in stages and working in those increments, okay? I just have a problem with squatting as my right knee seems to push out to the side when I squat down, causing pain around my right knee. Okay, so, right, that may potentially be a little bit of laxation in one of your ligaments. So I had an LCL injury. What actually happens, Michelle, is if your knee is pushing out, you have your MCL and your LCL inside and outside. They very much control the stability of your knee. What I mean by that is I'm going to give you a quick demo. It very much limits the amount of lateral stability you have. So I think I know what you mean. You're squatting and you're getting drifting with one knee. So what you might want to start trying to do is strengthening up the LCL and the MCL, okay? Start working on doing some stability work. This is absolutely perfect for that, okay? Before it develops into a serious injury, nip it in the bud. So we've got here something that is perfect for that. Look at the movement, okay? What's getting stressed now? The ligaments in the knees, trying to stabilize my knees, okay? Absolutely perfect. You can pick these up on Amazon for dirt cheap. That might just be your saving grace before it develops into something a little bit more sinister, okay? So if you're looking at a joint and it's moving in an irregular pattern, or if you're looking at your movement and you're noticing that your biomechanics is slightly off, very, very wisely, you've broke it down and you've realized where the issue is, okay? Look potentially further, Michelle, or further up, further down or up in the kinetic chain. All right. And maybe potentially there could be a little bit of lack of mobility through the hip. There could be a bit of lack of mobility through the actual ankle. So performing mobility before you start, you know, you can do the knees to wall test where you take your foot further away from the wall and see how close you can get your knee to the wall. Just as a little demonstration, it looks like this. Okay. So you can see that my knee's touching the wall and my foot's further back. You can also do movements such as laying butterfly, where you lay down on the floor and splay the knees. You could also sit in the lotus position, push the knees out. All of these movements is going to help with external rotation, stretch the hip flexors, and increase your ability to actually move into a squat position more efficiently. I hope that helps. Sorry, I can't go too deep into the knee injury, Michelle, but I'm sure you'll probably find that there may potentially be an issue further down or up. Nothing major. I wouldn't say it's anything major at all. It could be that it is the knee itself, in which case proprioceptive work and stability work is going to absolutely be your go-to. You could stand on a Bosu. You could stand on, that's like a big, what would you say that was that I was just stood on? The large spiky ball pad. Balance pod. Stand on a balance pod. All these sort of things are going to be fantastic for strengthening that MCL and that LCL. So obviously you've got your ACL, you've got your at the front, PCL at the back, and then you've got your MCL and your LCL. So lateral, medial, anterior, posterior. Yeah. Front, back, left, right. Sorry, fried my own bread then. Right then. Okay. Have a good night, and I will see you all soon next week. Have fun. Bye-bye.